Hi, I'm sure most of us have had a back pain episode in our lives, but if you had the unfortunate episode of pain shooting down your legs, this video is for you. Hi there, I'm Dr. Mahesh Mohan and I have Alexandra here with me.
Hi everybody, good afternoon Dr. Mohan, thank you for having me with you here today.
So today in our educational series we are going to discuss back pain which shoots down the leg or sciatica and epidural injection. Remember that this is only an educational video. For your treatment, follow the advice of your doctor.
My first question, and that will be, can you please tell us more what sciatica is?
Sure. Sciatica means inflamed sciatic nerve. So essentially the sciatic nerve is formed from nerve roots from lower lumbar and upper sacral levels, and any kind of inflammation there which is usually produced by disc bulge or disc protrusion or slip disc, which can lead to mechanical irritation of the nerve if the bulge is significant enough, or a chemical irritation or radiculitis if it can happen in both situations. So either the mechanical or chemical irritation of the sciatic nerve which cause symptoms which shoot down the leg is called sciatica.
Do all the patients feel the same degree of pain?
Well, there is a significant degree of variability, or not everybody feels the same. For some patients it could be a mere nuisance, whereas for someone else it could be very incapacitating pain, who may be having difficulty to even do self-care.
Can you please tell us more about how we can treat sciatica?
Well, we start with conservative measures. Of it, the most important is exercise therapy, or either physical therapy or chiropractic therapy. We can use non-steroidal anti-inflammatory like naproxen or Aleve or ibuprofen. We could use a short course of stronger pain medication if the activities are significantly limited, but it's better to avoid if it is possible. And the next is, very few people find it, traction may be helpful for neck pain, but that's one of the options. The next treatment option is epidural injection, which we are discussing, which could again be done with cortisone, which is the traditional way of doing it, or it also could be done with platelet lysate, which we do. And if the symptoms are progressing, like you're getting more and more muscle weakness or affecting bowel and bladder, then you may need a surgical consultation. But the good news is that most patients don't need surgery.
I have heard about epidurals. It's what a pregnant woman gets at the time of the delivery?
It's very similar, but in our clinic we do it more precisely using X-ray for guidance, and it hardly takes about 5 to 10 minutes.
Does steroid injection work all the time?
It has pretty high effectiveness. It works in about 9 out of 10 times, and it depends, everybody could be a little bit different. It could be a few weeks or it could be a few months.
You also mentioned previously about steroid injection with non-medication. Could you please let us about it?
You meant to say non-steroid medication?
Yes.
So we use two different kind of epidural injections. One is the traditional cortisone injection, and the other one is platelet lysate injection, which is more of a precise injection with breakdown particles from the platelets, and that's a newer therapy which has pretty exciting results.
We all know that no one is excited to get needle into the spine. Could you let us know about the value of epidural injections?
Well, you need to understand what sciatica is and what's the natural course of that to answer that question well. The good thing is that some of the patients can heal themselves, and the epidurals are perfect tool to buy time or to give you comfort and control the inflammation during the healing is happening, during the time that the healing is happening. So we can give an epidural that typically gives about 6 to 8 weeks of relief, and another epidural can be followed by that, and insurance typically approves 3 and 6 months time frame perfectly for that. So epidurals control pain, inflammation, enable the patient to continue working with physical therapy or chiropractic, so that we avoid any deconditioning of the muscle and there is good healing that's happening at the same time. And that works perfectly. And in addition, the epidurals are a perfect tool to localize the level of the lesion. Sometimes there are multiple levels of disc bulge and the surgeon is wondering where exactly is the problem.
With any medical procedure, as we all know, there could be some risk involved. Could you please let us know more about it?
Sure, there is some risk and mostly side effects, I would say. The most common are flare-up of pain, which would happen in a few patients out of 100. There could be a headache that hangs out for a few days or maybe a week, and you could have an allergy to the medications we use, or you could get a flushing from the steroid that we use. And more significant, but luckily the rarer risks include either bleeding or infection. And bleeding into spinal canal can be pretty significant risk, but it happens very rarely, probably 1 in 500,000. And we take all precautions, and rest be assured we have a good outcome. Overall, epidural is a good treatment option which can avoid the need for a surgery.
Hopefully today's video has answered some of your questions or concerns. Please feel free to reach to us. Have a blessed week.
Thank you for listening.